opioid epidemic. Don't blame the doctors. Doctors frequently treat patients with pain due to injury or surgery. Evaluation for pain has become required for proper patient care. Pain has become the fifth vital sign, such as temperature, heart rate, respiratory rate, and blood pressure. Our society has become intolerant of pain and discomfort. The patient expectation is not to have pain after an injury or surgery. Look at other countries. Patient in Netherlands leaves the hospital after fixation of their ankle fracture with Tylenol. They are satisfied with their pain relief, the same as patients taking oxycodone in the United States. The problem is the bureaucratic agencies pushed aggressively to evaluate the pain, and this leads to opioid over-prescribing. These bureaucratic agencies need to get rid of their harmful policies. The doctors are pressured by legal agents, by state medical societies, by the national organizations to make the patients happy. So the doctors went ahead and prescribed a lot of opiates, more than the patient needs, due to the existing culture of making the patient comfortable, happy, and satisfied. Because of the culture, an entry-level pain or an outpatient surgery was dealt with by strong medications so they can make the patient comfortable. So now we have a protocol for prescribing these medications. So the law set the expectation and the patient accepted. In Ohio, for example, no more than 90 days supply can be prescribed postoperatively by the surgeon. Only fill one prescription per week, and the max is 28 Percocet or 42 Norco. In prescription, the doctor has to fill the ICD code for proper diagnosis that matches the pain. The patient can obtain their medication from one provider only. Before the physician prescribes the medication, you got to check the ORs, which contain the patient history of prescription narcotic dispensing. But the doctors will need support to change the culture and change policies. For example, the smiley face shouldn't be used. Pain should not be numerical. That smiley face is really not important, and we should not use that in our practice. How about history of the present illness? When the doctor billed the patient, there is a history of the present illness. In orthopedics, we talk about pain. Where is the pain? For example, elbow, right or left? Right elbow. What makes the level of pain worse? What makes it better? Is the pain sharp or dull? Does the pain radiate to the hand and fingers? From 1 to 10, how much is the pain? There should be a better way to describe the history of the present illness than this way. How about patient survey and patient satisfaction? Pain is so important in these surveys, and compensation for doctors and for hospital could depend on these surveys. So let's see what's written. How well your pain was controlled? During the hospital stay, did you have any pain? Yes or no? During the hospital stay, how often did hospital staff talk with you about how much pain you had? Never, sometimes, usually, or always. During the hospital stay, how often did the hospital staff talk with you about how to treat your pain? Never, sometimes, usually, or always. In another survey, They have a global rating for the hospital, rate the hospital 0 to 10, and then section about the nurses, followed by a section about the doctors, followed by a section about pain. Did you have any pain? How often staff talk about pain? Another question, staff talk about pain treatment. And this is followed by another section about pain management. Utilization of pain management has increased significantly in the last few decades. I think the prescription drugs can be regulated and the rate of addiction to prescription drugs can be controlled. Cutting the prescription opiates may drive the patient to go to the street where heroin and fentanyl are cheaper. Minimally invasive techniques will give the patient less pain. Use of blocks after surgery and injury can be very helpful. Accusing the doctors of reckless negligence for inadequate treatment of pain should be stopped. I agree that the pain level of the patient should be observed, measured, and dealt with, but the doctor should have the ability to use their own judgment, and the professional medical organization should not be pushing pain and pain level on the doctors. Thank you very much. I hope that was helpful.